up, everyone? It's Chris from chrisbeatcancer.com, and today I am doing an interview in my living room with my friend Shannon Knight. And Shannon is a two-time survivor, refused chemotherapy, has an amazing story, dramatic cancer reversal in her life. So anyway, we've got a lot to talk about. It's going to be really great. And Shannon,
hi.
Thanks. Welcome to my house.
Happy to be in your Christmassy festive house. It's beautiful.
I can show off the tree, my wife's beautiful tree that she decorated.
This is a good spot for an interview.
Yeah. All right, let's talk about you. Let's start with your story because we are both cancer survivors. You were diagnosed with breast cancer.
2006, that was the first time. They first did a lumpectomy and found it in my lymph nodes, but because there was one that was right here, we went ahead and did the bilateral mastectomy. They wanted me to follow up with radiation and 3 types of chemotherapy. I got a staph infection from that surgery, so I ended up back in the hospital on IV antibiotics.
So did you have chemotherapy or not?
I knew that if I was so sick from the antibiotic, how was I going to handle the chemo? I went into, remission, but then I moved to California. I was in Seattle and I had a vitamin D deficiency, which I found out later. So that's a huge part, I believe, of why I got breast cancer in the first place.
So the cancer came back when?
Well, I had the symptoms in 2009.
Okay, so it's about 3 years later. Yeah.
And the cough just would not go away, and I had bone pain. And I was working. I would go to the ER thinking I was having a heart attack.
Oh, wow.
So I would just try to complete my work and then drive straight to the hospital. And they diagnosed me with asthma and costochondritis, which is inflammation of the rib cartilage. I was getting a little bit nervous, but then there was a lump starting to form right here on my sternum, and it was tender. So they gave me a lidoderm pain patch. Still diagnosed with, they did the CAT scan, still costochondritis and asthma. I'm nervous, and the pain's getting worse. Nothing's working. Now they're doing a fentanyl patch. Oh, and I'd been doing my lab work for my tumor marker. Everything read perfect. So my tumor marker is unreliable, and that is common. So I think that people need to be aware of that. If you've got symptoms and you go and you get tested, you could have a recurrence and it's not showing up in your blood work. So I finally go to the doctor and I say, I think it's more. Just keep going with the symptoms and go further. Because this went on from October and the final diagnosis hit in July. And
so it's almost 9 months it took them to diagnose you with cancer the second time.
Yeah. And when they did, I finally went to my oncologist, great, wonderful, compassionate doctor, UCLA doctor. He asked for all of the ER records. The paperwork said suspicious for metastatic disease. I had never gotten those reports. They didn't prompt me to get them because they had given me discharge papers with the diagnosis of costochondritis and asthma. So make sure you get all your records because we really do have to be responsible. They're busy in the ER. They've got someone looking at your paperwork and it's stored. Go pick up your disc and go get the report of findings.
So what was the next course of therapy after that diagnosis?
They wanted me to do radiation. This is while I've got a cough. And they diagnosed me through mediastinoscopy, I think it's called, or where they cut through your throat and they get a sample of the tissue of what's growing on your bone. And it was cancer. And the PET scan showed that it had metastasized to all lobes of my lungs.
So now you're stage 4.
Oh, yeah. So my world, much like you talked about, was spinning. I didn't see another year of Christmas. I didn't see anything.
Well,
I've
I can't
got two
imagine.
kids.
I mean, one diagnosis is scary, but I was never re-diagnosed, right? And I can't even imagine what that feels like, to like just the overwhelming despair. I can imagine.
The success rate was so low.
Oh, yeah.
It was 2%, I think. To make it
with
to
long mets,
it was bad, and he said it was aggressive.
right?
3
So what
months
they want
to
you
a
to
year, survival. So all my family's sitting around and friends while we're having this discussion of what's the next step. So we went and saw the radiation oncologist, and he made it even more grim and said, basically like, if you don't do it, you're a fool. So I started doing it. My cough got worse, and the pneumonia set in. He said it wasn't going to hit my lungs. Well, I had a burn the size of a football, and they did it from the back also. There's just no way that what he was telling me was what was going on. So he made it sound like it was only going to pinpoint and target the area, but there was just a blast of red everywhere, and blister and peeling skin.
Yeah.
I look at that.
That must have been just a miserable situation.
It was, and I felt like I was really trying. My image was I didn't want to break there, like the bone. I didn't want to break, and I didn't want to be paralyzed. That's what pushed me. That fear of, if I'm gonna die, let me not be paralyzed first.
You were at that point you lost a lot of weight, right? And you were basically too thin to do chemo or whatever.
I can't even imagine.
Yeah.
That would have been, I'd lost a lot of weight.
Yeah, you'd probably be
times.
dead.
Yeah.
Yeah.
We just know what that does.
So what happened after the radiation? So you stopped radiation, and you started Angels for Shannon, and started trying to raise money to afford
Mexico.
Alternative treatments in Mexico.
And my girlfriends all live in Washington, and they supported that and wanted to help me get the treatment that I wanted. They believed in I had the support I needed.
Yeah, that's so huge. That's such a huge blessing.
They raised most of the money in Washington while I was in California, just in one fundraiser. So we raised enough money to get me to Mexico.
One of the therapies you did?
Yeah.
For anybody that's...
Yeah. One of them was the dendritic cell therapy, ozone therapy, the IVs, B17,
Yep.
Vitamin C. Then there's the hypothermia, creating the temperature, because our immune system doesn't kick in to fight like that with the fever.
Yep.
That's fascinating. Well, I started noticing a difference while I was there, improvement. So that was very hopeful. Instead of getting worse, I started to get better.
So physical symptoms changed.
And it also helps with, even if you did go through chemo and radiation, all of those therapies start to heal the body from all the damage that you've gone through from that treatment.
Yeah. How quickly did you get to the point where it was like, oh, there's no cancer in my body now?
It was August.
Okay.
So I went in February.
Okay.
It
About
was
6
August.
months.
And it was confirmed in October with a PET scan.
Awesome.
And the doctor was blown away. He said,
I'm sure.
It's nothing short of a miracle.
And you're like, it's not a miracle.
No.
It was a lot of hard work.
He was so amazing, though. He asked for my paperwork and wanted to take it to the next cancer conference. Don't know what he
Wow.
did with it.
That's great, though, that he actually wanted to share it.
Yes.
Most oncologists are like, oh, that's nice. Just keep doing what you're doing. And then
He's
they're just
amazing. He's
off to
amazing.
the next guy.
And he was the one that called it the Sunshine Farm and teased me about it in the beginning. So he still did my lab work. A lot of people are afraid to, I hear this a lot, I don't know if you do, but they're afraid to let their doctor know that they're going to go do alternative treatments because they're afraid they'll get cut off from being seen.
Yeah. But, what I tell people is, if you want to be honest and tell your doctor what you're doing, that's fine. If they don't like it, then you just need to find a new doctor that will support you. So, but again, that's fine. Just you find another doctor, meet with them on your terms. This is what I'm doing. Will you support me? Can you do my blood work, my scans? Start on neutral territory. We talk about what was going on in your life, in your personal life that you think contributed to cancer.
Yeah, I was a victim of a crime and had to change my name. I moved to Washington State. I had a very difficult time. Now, this is what's really ironic. They say that women get breast cancer, you can sometimes count back 5 years. Okay, I found that lump the first time in 2005. I moved there in 2000 because I was a stalking victim.
Wow.
And there was a lot more to it. I had read some research on that emotionally women can get that. And that the emotional part of that, I remember if I heard my name, which is Jennifer, and it's my middle name, I don't mind, it's coming out anyway now, so my heart would race and I'd go like this. And so it's always on my chest.
Wow.
Isn't that ironic?
Yeah.
So because you long for your old life, you long for your identity, you long to go back where you were.
Yeah.
And you're just, there's this absence and this longing. You feel a loss. It's a grieving.
Yeah.
People grieve when they lose their job.
You were totally lost.
Yeah.
I mean, living in a fearful sort of stress.
No car for 2 years.
Oh, yeah.
The car blew up. I'm just missing everyone, not being able to explain everything that happened. So there was a lot of trauma there.
Yeah. Major.
So it was a perfect setup for no sunshine, vitamin D deficiency, no emotional support, no family. So I finally came home when it was safe, 2009. I had to come back home and revisit where everything had happened.
After the first diagnosis, 2006 to 2009, had you addressed those issues in your life yet?
No. When I got home, I got the counseling.
Yeah, and I see that. I see that with people is they can do a therapy. It might be an alternative therapy, it might be chemo, and they get results or the cancer's gone or whatever, but they don't address the real underlying deep causes, and that's usually the stress and emotions.
Shame.
All negative
You're
emotions.
Feeling shame. You don't know why, but
guilt, shame, right? Self-hatred, self-loathing, envy, jealousy, all negative emotions are so powerful. And if a cancer patient, they can do every therapy in the world, but if they don't get to the root cause and address any of those really strong emotions and things from their past or things in their present, it's coming back.
Yeah. And when you make peace with it, You don't have shame. This is who I am.
Yeah, it is.
If
It is
family
what it
can't
is.
accept it, that's not my problem, that's their problem. If friends can't accept it, that's not my issue, that's theirs.
Right.
And really owning that.
Yep.
That's so healthy.
It is.
And when people can learn that and really believe it and feel it and just let go, you feel it, whole weight lifting off.
Yep.
Forgiveness is so important. Forgiving the perpetrator, I just kind of let go. Because he was sick. I just let go.
Yeah. I think asking yourself, what do I need to change, is one of the most powerful questions you can ask, and especially for a cancer patient.
Yeah.
Right? What's going on in my life? What's wrong in my life? What can I change? Right? Because most people assume they can't change anything. You can change your whole life.
Absolutely.
Well, Shannon Knight, this has been awesome.
It has been.
Thank you so much.
Thank you.
Thank you for watching.
Thank you.
Please check out, this is where you can find Shannon. Share it with your friends and family, share it on social media, subscribe to my YouTube channel, and thanks again for watching.